A Hamilton dentist has described New Zealanders as having third world dental problems and has started a petition calling on the government to subsidise visits. Assil Russell, who co-founded the charity dental service Revive a Smile, says she's seen patients who've resorted to pulling out their own teeth because they can't afford a trip to the dentist. She told me she plans to take the petition to Parliament later this year, calling for the dental visits to be subsidised just like the doctor's visits.
The idea is that people who, for example, have a community services card, who are low to mid-income, people who are in the elderly group, the youth, so people who are not yet in employment, maybe people who are at varsity. So those are the types of people that would be benefiting from a subsidised dental care. Obviously, I mean, in the ideal world, it would be free for everyone, but realistically, we know that that's a big ask. So asking for a subsidy for at-need groups is a concrete step in the right direction.
What are some of the things that you see in your work as a result of people not getting proper dental treatment?
So we're really seeing quite severe infections in some of the cases that are coming through the charity clinics. So people that have left it for a long time, so that may have had a toothache and just ignored it, and then the problem progressed over time. So it affects their general health as well. So we're seeing people who are coming in with a lot of pain. Sometimes people have tried to seek help, but the wind grants weren't sufficient or something like that, and so they didn't end up getting it in the end. Yeah, so we've been working closely with the Southern Cross Health Trust, and they've helped to sponsor us and make our work possible, and we've been travelling around New Zealand providing free care for these sorts of people. Yeah.
Is it a situation where if you were able to afford to pay for sort of the early dental problems, then you wouldn't have these sort of horrific bills that come with a nasty dental problem?
Oh, absolutely. I mean, we strongly advocate for people to go in regularly, and I think that's an issue in New Zealand, that people aren't seeking their regular checkups. They just go when there's a problem. So if people go quite regularly, it's not that costly to go in for a checkup and x-rays, but it is quite costly to go in when there's major work that needs to be done.
Which groups or which age groups are you seeing most affected by these problems?
Look, it's honestly across board. So, we're seeing people who have gone to varsity and it stopped being free at the age of 18, and they aren't able to go and access care when they need it, so they leave it and they come to us in their 20s with major issues. We see a lot of the elderly communities that can't afford to go to see a dentist, so they're leaving it as well, and they come in with major problems. And adults of all ages, so it's really not specific to one certain age group. It's across board and across communities as well. So with our clinics, we've travelled from the far north and all across the North Island, and the problems we're seeing in the far north are similar to the ones we see in West Auckland and in the Waikato. So it's not generally specific to a particular age group or to a particular area as well.
Have you seen any cases or know of any cases of people pulling out their own teeth?
Yep, absolutely. So we've had quite a few cases that come through our charity clinic with people that have tried to give it a go themselves and do a bit of DIY dentistry, and it never ends well, and we strongly don't recommend that anyone does do that. It's a very dangerous thing to do, and especially with the use of unsterile equipment. There's a lot of blood vessels and things in the mouth that, if they're nicked, can cause some major issues. So it's really sad that this sort of thing is happening in New Zealand, but it definitely is, and it's time that something is done about it. And New Zealanders should have the right to access qualified dentists, and one way to make that more affordable is to subsidise dentistry for at-need adults.
What advice do you have for people who can't afford to go to the dentist?
So one thing, of course, is to apply through the Revive a Smile charity clinics. There's a simple application process that they can do through the website, which is nzdentalcharity.org. And a lot of our work is made possible with thanks to Southern Cross Health Trust and other community grants. if they can't access us or would like to see their own dentist, I think just talk to your dentist as well. There's a big misconception in New Zealand that dentists are greedy people. They're really not. The reason dentistry is expensive is because of the high costs associated with running a practice. And I know many clinics that offer payment plans and payment options for people if the work that's needed is quite major. So definitely don't leave it if you're suffering from any sort of toothache. It's not going to go away. It's only going to get worse over time. So seek help, whether it's through us or through your local practices.
How does New Zealand compare to the rest of the developed world when it comes to affordable access to dental care?
Look, I mean, I'm no expert in what's going on overseas, but what I do know is that we're not seeing first world problems here. We're seeing quite third world issues when it comes to dental problems. And in some areas overseas, the dentistry is subsidised, so people can go to the dentist and they're only paying a fraction of the cost of what the appointment would actually cost. And in New Zealand, doctors' visits are subsidised, so it doesn't make sense that we're putting dentistry on a lower priority, whereas in fact it should be right up there with general health. So you go to the doctor and you only pay a very small amount compared to what the actual cost of the appointment is. And the running of a medical practice has as much overhead costs as a dentist practice, and probably dentists have more overhead costs. So I think, it's good to look at overseas models that work as well, but I think definitely in New Zealand we need to consider seriously subsidising it for the at-need communities here.
And that's Hamilton dentist Assil Russell.